Good evening, dear friends. My name is Dr.Paritosh Tiwari. I am a family physician and sexologist working in Bahrain last year. Welcome to the webinar. As we are discussing on Pde5 inhibitor, one of the core drugs for the treatment of erectile dysfunction. I will like to talk about Pde5 inhibitors and alcoholic drink. Though alcohol consumption is not considered good for health, but today drinking has just become very common in society. And especially in some societies, drinking and sex go together. So many times our patients ask me, can I drink with my medicine? Just explaining them not to drink is not possible. So to know what to answer them, we need to discuss our topic PDE5 inhibitors and alcohol in detail to the presentation. As has been told by some of our fellow speakers, erectile dysfunction is the most common sex problem that men report to their doctor. Erectile dysfunction is a problem with getting and maintaining erection that is firm enough to have a sexual intercourse, and it is the most common sex problem that men report to their doctor, and it affects as many as 30 million men in the United States, according to data of National Institute of Health in US. ED may be caused by due to some many reasons like injuries, medications, psychological conditions, and are using alcohol, drink, etc. According to the reports of Global Information System on Alcohol and Health, consumption of alcohol was 6.2 liters pure alcohol per person who were 15 and older. The unrecorded consumption of account for 26% of worldwide consumption. In India, also alcohol consumption is widespread according to National Family Health Survey (NFS) code. Approximately 160 million consumes alcohol in it. 29.2% are men and 1.2% are women consume alcohol. As you can see in the map, state and district-wise comparison of alcohol consumption in men and women. This report is in the national. This report is the National Family Health Survey (NFS) code. PDE5 inhibitors, as phosphodiesterase type PDE5 inhibitor is vasodilating agent which works on blocking the degenerative action of cyclic GMP, specific phosphodiesterase type 5 inhibitors on cyclic GMP in the smooth muscle cell lining the blood vessels supplying to various tissues. These drugs dilate the corpora cavernosa of penis and facilitating erection with sexual stimulation and are used in the treatment of erectile dysfunction. PDE5 inhibitors are most prescribed drugs to treat the erectile dysfunction. 7 types of PDE5 inhibitors are available, including sildenafil, tadalafil, vardenafil, elnafil, sildenafil, virodinafil, and lodenafil. The drug available in Indian market included sildenafil, tadalafil, elnafil, and vardenafil. So, why people are using PDE5 inhibitor with alcohol? In this slide, you can see that what are the few reasons for concomitant alcohol use with PDE5 inhibitors. They are like curiosity, to reduce respiratory time, to enhance sexual desire, improve erectile dysfunction by recommendation of friends, and fear of erectile dysfunction. So, why to discuss the use of PDE5 inhibitors with alcohol? In this slide, you can see as the alcohol has become very common in our society, and just to say patient to stop drinking once you are on medication can little be difficult for him to do and can generate other problems for him or her. So there is need of talk about the drugs which do not have much side effect on the patient if he or she is a moderate drinker. Alcohol decreases blood pressure by causing the vasodilation, and as it increases the production of nitrous oxide from the endothelium, which result in the subsequent decrease decrease in the vascular smooth muscle tone. PDE5 inhibitors is predominantly found in the spinal corpora and lungs. It still can be expressed in the major systemic vessels. The inhibitors of PDE5 inhibitor result in inhibition of the PDE5 result in smooth muscle relaxation in the corpora cavernosa, as well as systemic vasculature, introducing subsequent vasodilation and lowering of the blood pressure. PDE5 inhibitor and alcohol, however, did not interact in a way that resulted in an increase of the hypotensive effect individually presented by them. Studies suggest there is no clinical important hemodynamic interaction between the PDE5 inhibitor and alcohol occurs. These are the few studies uh, shown in the slide. I don't want to go in the detail, but these studies suggest done on the use of alcohol and PDE5 inhibitors suggest no clinical relevant pharmacodynamics or pharmacokinetics interaction were detected. But it should always be kept in mind that this result is only for the moderate drinking. Excessive amount of alcohol intake can be dangerous. Studies proved that concomitant administration of all the four drugs with alcohol was well tolerated. No clinical relevant pharmacodynamics and pharmacokinetic interactions were detected. So the next question is arises in our mind is what is the moderate drinking? In simple words, we can say that moderate drinking is fewer than the 3 alcohol drinks per day. The amount in alcoholic drink varies according to type of alcohol. For example, one alcoholic drink could be 12 ounces in beer, 5 ounces in wine, and 1.5 ounce in 80% of liquor such as gin, vodka, whiskey, rum, and tequila. Consuming 5 or more drinks at a time while taking uh, any PDA5 inhibitor have been linked to orthostatic hypotension that amount a bit more than what is considered to moderate drinking. If we talk about moderate drinking in approximate measurement, following quantity have been said to be moderate with different PDE5 inhibitors drug. In approximate measurement, what is moderate drinking with the various PDE5 inhibitors? Alcohol 0.5 gram per kg body weight, approximately 40 ml of absolute alcohol in a 70 kg person. When combined with any of the following PDE5 inhibitors, sildenafil 50 mg, avenafil 200 mg, and varnafil 200 mg, pharmacokinetics and pharmacodynamics were not altered. And tadalafil 20 mg did not potentiate the hypotensive effect of alcohol during the 4 hours observation period in the healthy volunteers when administered with alcohol 0.6 gram per kg body weight, approximately 40 ml of absolute alcohol in 70 kg person. So, substantial consumption of alcohol greater than 3 units in combination with PD5 inhibitor can increase the potential for orthostatic signs and symptoms, including increase the heart rate, decrease in the standing blood pressure, dizziness, and headache. Though the studies shows no adverse, though the studies shows no adverse hemodynamic interaction between the PD5 inhibitors and alcohol, but still before taking alcohol with any of PD5 inhibitors, one should consult their doctor. Doctor should also talk to the patient about the patient's drinking habit before prescribing any of PD5 inhibitors. And this brings me to end of my presentation. Thank you. And I hope my presentation was effective. Thanks for taking out time to be here and for listening to my presentation so attentively. And thank you again.